Welcome back to HEAL Module 2, organized by Dr. Shaw. My name is Dr. Cissy Atwine, and I'm a psychiatrist in training. And I'm going to present today a topic on mental health, under which we have depression, bipolar disorder, schizophrenia, autism, and ADHD. These slides were kindly written by Dr. Sodiq, and I hope I do them justice. Thank you so much. To begin with, what is mental health? Mental health encompasses our well-being, that's influencing our thoughts, our emotions, our actions, and stress management right from infancy up to adulthood. Mental illnesses can include various conditions, for instance, depression, anxiety, addiction, and the impact on our daily lives. And treatment usually involves a combination of medication and psychotherapy, as well as social factors, because we do know that in psychiatry, we tend to use a biopsychosocial model, which is that the biology causing the mental health condition, the psychology, that is the thoughts and your cognition and the way you look at things, and also the social factors are really important. Over 200 mental health disorders exist, including anxiety, depression, autism, ADHD, schizophrenia, and even many others. So what causes people to have mental health conditions, or the risk factors for mental health disorders? One of them is genetic abnormalities. In some conditions, you are more likely to get certain disorders. So for instance, bipolar disorder, especially for instance, like postpartum psychosis, is more likely to happen if a family member of yours, let's say like your mom had postpartum psychosis after she had you, you are more likely to have it as well. Chemical imbalances in the brain have been suggested as potential causes. One of them for depression is called the serotonin theory. That has recently been disproved. So we don't entirely know exactly a lot of these things, but we suspect that they might be. Another thing is substance misuse. So for instance, if you use cannabis, you are more likely to get psychosis. Inadequate nutrition, so malnutrition. If you don't have vitamin B12, that can affect your mental health as well. If you don't have vitamin, folic acid, iron, inadequate nutrition can affect your mental health. So that's why whenever we admit patients on inpatients of psychiatry, we tend to what's their folic acid like, what's their vitamin D, what's their vitamin B, because a lot of these micronutrients, if you're low on them, they can cause you symptoms to look like you have a mental health disorder when actually you're malnourished. And if you fix those nutrition deficiencies, then your mental health will also be fine. Lack of social support can definitely increase stress levels, increase anxiety. Having a traumatic birth, so for instance, if you're a mom and you have a traumatic birth, that might affect your mental anxiety, depression. Chronic medical conditions like diabetes, HIV, AIDS, hypertension can affect your mental health. If you have a family history of behavioral disorders, for instance, like ADHD, sometimes you're more likely to have it if it's been happening in your family. Neurological disorders, like if you happen to have epilepsy, you're more likely to have depression. Sleep problems, extreme stress, traumatic brain injury, history of abuse, all these are really risk factors for mental health disorders. What do mental health disorders look like, or what are the symptoms of mental health disorders? These are various, it's a lot of them, and it depends on which one. So it's very difficult because of no definitive physical tests. So for instance, in physical health conditions, like if you have high blood pressure or diabetes, it's very easy to test because there's a blood test for diabetes. We have machines that can test your blood pressure and can give you a number and say above this number is high blood pressure, below it's not, or above this number is diabetes and below it is not. But for mental health conditions, there is no number above which we can say that now this is depression and this is not. There are screening tools that try and make this more objective and count symptoms, but actually, how much can you say that this person is not sad enough and so it's not depression, or this person is maybe too sad that it's going beyond the level of mild, moderate, and severe? It's all very subjective. These are some of the warning signs. Number one, withdrawing from family, friends, and co-workers. Number two, avoiding things that you used to find enjoyable before, or you do these activities and you just aren't finding them as enjoyable as they were. Excessive sleep or even too little sleep. A lot of times it's too little sleep, but sometimes it's too much sleep. Eating too much or even eating too little. Feeling hopeless, having low energy all the time. As you can see, the symptoms can be really, really broad. There's a broad range of symptoms. In terms of stigmas and barriers to mental health support, we have a lot, especially in Black people. We struggle with stigmas and barriers hinder Black people from seeking mental health support. For instance, there's a lot of stigma that people think that help seeking is perceived as being weak, or expecting people to snap out of it. There are also barriers that include social perceptions of mental illness, fear of stigma, cultural and religious factors, lack of awareness, financial constraints, self-stigma, and limited resources. One of the things that I think really comes up a lot in Black people in terms of sort of stigma towards getting help is, for instance, thinking that you're weak, or maybe you're not having faith, especially if you're a religious person. Religious people usually feel like maybe if they admit that they're having anxiety or depression, then maybe they're not having enough faith. Because I think, for instance, in Christians, there's some Bible verses that talk about not having anxiety, you shouldn't worry. If you're having anxiety or you're worrying, then maybe it's a sign that you don't have faith in God. And so I think those are kind of things that make it difficult for people to seek support. And yet I feel like, as I am not a Bible scholar, but at least I know that God created people and has given us all these tools and resources. And so I think it's okay to seek help if you need it. Mental health disparities within Black communities. So as Black people, we tend to have even more mental health challenges, especially if you're in the diaspora. We have unequal access to resources and treatment, and yet we face higher rates of psychological distress, schizophrenia, and sometimes suicide attempts, especially out in the diaspora. So for instance, Black people are about 9 times more likely to suffer from psychosis and compared to white people in the UK. And these rates are not the same as they are in their countries of origin. So that means there is something about being a Black person in a predominantly white society that is going to increase your rate of struggling with your mental health. Black youth who have been exposed to violence are more likely to develop PTSD. And for instance, currently where I live in England, in London, there's been a higher rate of knife crime. So Black youth are killing themselves, and this is definitely going to affect their mental health. Black children represent a significant proportion of those in foster care and the juvenile justice system, especially in the US and also the UK. And these issues also tend to extend beyond the US and into the broader Black diaspora. One of the factors that are contributing to these mental health disparities within Black communities include cultural competence or incompetence, really, of healthcare providers. If healthcare providers are not culturally aware of the issues that affect Black people, they might, for instance, see some things and call them disorders when actually it's just difference, when actually being different is not a disorder. So there is need for cultural competence within the mental health care professionals. There's cultural mistrust. So Black people tend to mistrust white people generally, but more so in the mental health setting because of the previous historical factors of being enslaved and being mistreated. So why would you be going to someone like this to help you? So these are the kind of reasons that are going to cause the cultural mistrust. So people don't seek help because they're worried about that. The access barriers. So sometimes you don't even have the support. So for instance, in the UK, mental health care is going to be dependent on where you live. And the areas that tend to have more Black people tend to be more socially deprived and have less access to better quality services. There's the stigma that we talked about already, and also the coping mechanisms that people have. People within Black communities tend to use their own society as a greater support than to seek for help formally through the mental health services available. What is the management of mental health disorders? So it might have looked like it's been pretty much bleak, but it's not. The future is bright. There's a lot that we can do. There are numerous approaches to managing mental health issues. And one of them is that we need to be more individualized. You cannot just give blanket approach to everyone. So strategies for treatment include combination of different ones. Number one is talking therapy. Talking therapy is really good for a lot of mild to moderate conditions, even severe. And then also medication is also very good, especially for severe mental illnesses like severe depression, severe anxiety, and severe psychosis. You do want to be using medication to at least bring a person down to a point that you can engage in talking therapy. And a combination of both is usually better than using one or the other by itself. Another important point is really the social factors. If someone has severe anxiety, severe depression, and they're struggling in their house, maybe they're going to be made homeless, they're struggling with their debts, then you want to be supporting this person as much as possible. And in mental health services, one of the things that we do is, for instance, we can write support letters. If someone is requiring housing, we can write support letters to send to the council to help them out, because however much you talk and talk and talk with this person in talking therapy, if at the end of the day, a huge source of their anxiety is that they're going to be homeless, you want to fix the social factors as well. self-help and mental well-being. While there's a lot that we can do for you as professionals, there is a lot that you as an individual need to do for yourself. One of them include, if you happen to be using a lot of alcohol, trying to find out how to reduce this alcohol. There are services that are available to help. In the UK, we have something called Change, Grow, Live, which will vary depending on where you live. But the services that can help to support you if you want to cut down on alcohol use. Improving your sleep. If you know that you don't have good sleep hygiene practices, you're going to bed late every day, you're constantly using the blue lights closer to bedtime, you want to have a balanced diet, trying to increase a lot of whole unprocessed foods in your diet as much as possible, reduce on these super ultra processed foods. This can really help your mental health. Addressing work-related stress or relationship issues is crucial. So if you're struggling in your relationships with your partner, with your family, with your parents, you want to be working on those in as much as you can, because remember, there's a lot that's not in your control, but you want to try and figure out what is in your control and what can you do about that. Techniques like deep breathing are really good for anxiety. Mindfulness is really good. So there's a lot of times that we're doing things on autopilot, like you're living your life on autopilot. You wake up and automatically just do what you always do, not really thinking through, trying to be more mindful. Like if you're brushing your teeth, do it more mindfully and try and observe, what are you really feeling. This is really good for life in general, because a lot of times being about the future or ruminating so much about the past robs you of the present moment, and you're not enjoying your life as much. A strong support network is really important. So really plug into the community that you have around you. Don't self-isolate. So how are we going to address the mental health disparities within Black communities? One of them is to provide culturally competent care. That is, provide the mental health professionals should be provided with training in culturally competent care. So that is, they should know, because the UK, for instance, has a lot of different like ethnicities and people from all over the world. So for instance, the town where I live, we have over 200 languages spoken here. So if you're a mental health professional in these areas, you're going to be educating yourself on the different cultures that are available, and also to see what things are done differently. The next thing is representation. So that is person out there and you're interested in mental health, definitely do it, because we need to have more of us out here on the other side, because then you're able to educate the people that you work with. So for instance, in my workplace, if people are working with someone from maybe a Black background, maybe someone happened to have a Ugandan person they're working with, and I'm a Ugandan, and they're able to consult and say, I have this patient and they're asking this and this, is this culturally appropriate? Yes, maybe it is, or maybe. So we need to collaborate as well with community leaders. So for instance, if there is an association of, let's say, Nigerians in a particular town, and you're working with them, you want to work with the leaders to be able to advise you on how best to tailor services to help that particular community. We want to increase access as well, provide more mental health services to people who need them most, especially in these more deprived areas. And this community outreach and education. So I would like to thank Dr. Shaw, for instance, who has provided this course, who has organized it. And I think this is a type of community outreach or online, but we're hoping that we can provide good quality health education to different people who need it and can access it online. And we do want to take efforts to reduce mental disparities within the Black communities, and want to be sensitive to the historical, cultural, and socioeconomic factors that contribute to these disparities. By addressing these issues, we can work towards a more equitable and inclusive mental health care system. These are our references, and I hope you enjoyed that video, guys. If you have any questions, please do leave them in the comments below, and I'll make sure I come and have a look and get back to you. If you like this video, please give it a thumbs up. And if you know anyone who will benefit from this information, please do share it with them. Thank you.